We continue to see about 17% of our African American population and just under 5% of our Hispanic population and communities that are testing positive for COVID-19. We expected to see these disparities with regards to COVID-19 in our African American population, as we do with many other health conditions, and we've been making a concerted effort to increase outreach and access to testing in these communities. Also, on the next slide, you can see the deaths that have occurred by race and ethnicity. About 66% of our deaths were to individuals who are white, and about 18% in the African American population, and 1.7% in the Latino population. In addition to the clinics that we've hosted in Lake County, the work being done in Indianapolis by the Marion County Public Health Department and Eli Lilly, we have been working with partners including our Indiana Minority Health Coalition, our Indiana Black Expo, Indiana Latino Expo, and the Indiana Native American Commission, along with the LGBTQ community. Our Office of Minority Health has hosted a series of webinars and focused on COVID-19 to better inform our minority communities about best practices, coping strategies, social determinants of health as they pertain to this novel coronavirus. We're also participating in a work group with the Indiana Institute on Disability and Community at IU Bloomington, and working with our regional and national offices of minority health to better serve our most vulnerable population. One thing that Dr. Sullivan pointed out to me the other day that I think is really important to remember, that as we are asking everyone to mask, individuals in our deaf community who read lips will be severely disadvantaged with that wearing of masks. Since Mayor Prince is with us today from Gary, Indiana, I wanted to highlight some of the partnerships the state has been working on with both Lake County and the city of Gary to better serve Hoosiers in these communities. We've provided thousands of pieces of personal protective equipment to their 3 local health departments, EMS providers, and hospitals in the Lake County area. We've worked with the local hospitals and their incident commands in the region for local surge planning and to discuss any need for alternative care sites. Our 13 hospitals in Lake County also received 26 ventilators this past weekend that were distributed from HHS. For individuals who are experiencing homelessness, we're also waiting their test results or have tested positive for COVID-19. We have set up a safe recovery site in Lake County so that they have access to secure housing, food, and medical care. None of this work, however, would have been possible without our incredible partnerships at the local and the state and federal levels. To everyone who has provided supplies and helped them to get where they are needed on short notice, and to all of our healthcare workers, local health departments, and community partners, I say thank you. Governor? Did I make a mistake?
No, you didn't. It was we'll chalk this up to technology. There was no sound during just a portion. Just a portion, not the whole thing, okay. But during when you reported on the fatalities, the death numbers,
sure,
the hospital numbers, events, and ICU beds, could you and then they picked up right after the ICU numbers.
Sure. So we can go back over that. Yeah. I'm sorry. So as you can see, we had 431 new cases that were reported in the last 24 hours, with unfortunately 61 deaths reported. I think the important thing to notice here is those 61 deaths were spread out over a number of days, and as I've already highlighted in one of the slides, I think you've seen, it's very important to note that those came just in the last 3 days over the weekend, and we'll get to that slide. Also, when we look at the deaths in the state of Indiana, you can see this by county. And I want to highlight that if you go to our maps on our actual interactive website, you will see more county level data there that you have been requesting. When we look at the details of testing reporting, we've now tested 67,264 individuals in the state, with just 2,600 additional deaths that were added today, and that was a little low because we had some technical glitches that have now been worked out. When we look at our ICU bed availability, you can see that we have about 47% of our beds that are available, with 22.5% of them that were actually being used for COVID positive patients. And then when we look at our ventilators, 77.1% of them are available, with 11.6% of them in use by COVID positive patients.
Thank you.
Thanks, Governor.
Second time's a charm. That's just proof that this is live. It's not recorded, and I want to thank the studio crew here for the quick work to resolve that. We are, as you mentioned, Dr. Box, fortunate to have two, not just prominent leaders in their cities, but two prominent leaders in our state. You mentioned Mayor Jerome Prince up in Gary, Indiana. We also have Mayor Mike Moore from Jeffersonville, Indiana, and I think Mike, you're going to lead off. Appreciate you being with us, and I know this COVID-19 has hit really close to home for you. We have had your family in our thoughts and prayers from the outset, and it's just good to see your family, one Southern Indiana, big family down there, but in Jeffersonville, you all have done so much to come together and really punch back on this. Can you give us a quick thumbnail sketch of where we are today down in Jeff?
Well, I think there's a positive outlook. As crazy as that may sound right now with, all the drama that comes along with this, I get the sense we've weathered the tough days. There's still some tough days ahead of us, but I think our hard work is paying off. It's kind of nice to look around at a time when your city and your state has been tested. People stepped up.
Yeah.
They've done the right things, and it's just it's a good feeling in Jeffersonville to know that we can go through the toughest of times and we stick together. And it's everybody from the healthcare workers to the grocery store employees to the police, the fire, and just the next door neighbors who have gone out and made sure everybody and their families and their neighborhoods are well. It's a good feeling, and we're not over it yet, but I can see that light at the end of the tunnel, and I think when this is all said and done, we're going to come out of this a little bit stronger than we were when we walked in.
Yeah,
I was just going to say, Mayor, I'm so sorry. I missed the 411 that you were on today, too. I would have brought more specific information for your area. I apologize for that.
Well, it's all right. You tend to be passing on some bad news.
That's our doctor. She shoots straight. Thank you, Mayor Moore. Appreciate it. Everything you're doing down there. Thanks for holding it all together and working just on a daily basis with us. Next, we've got Mayor Jerome Prince, as far away from Jeffersonville as you can go and still be in the state of Indiana. Mayor Prince, thank you so much for right out of the gate when this started to really unfold. We were getting connected, you and I and our staffs together, and we have seen in your community, in fact in the region, but in your community specifically, your first frontline workers and your healthcare workers all coming together again. It's really been heartening to see that, and for you to be leading the effort there on the ground. And as you know, when that next phase, if it comes, we're right there with you. But just wanted to really express our gratitude for your strong and consistent leadership on the ground every minute of the day.
Well, thank you, Governor, and certainly I'm glad to be here with you and Dr. Box as well as Mayor Moore, who I'm not sure if we've met before, so hello, Mayor. Yeah, but you're right, Governor. Since the beginning of, well, certainly not the very beginning, but since things ramped up in the state of Indiana, we as a community have been, at least from our perspective, abreast, or at least attempting to stay abreast of all of the current trends and data. Having said that, we patterned most of our response after what you and the state certainly is initiating, as well as the federal government. We continue to support the stay-at-home order, and to that extent, by getting ahead of it very early on, we've certainly had successes with the churches and funeral homes and other busy institutions, and certainly had a degree of success with continuing to encourage people to practice social distancing. Here locally, some of the steps that we've taken is to communicate on a near daily basis with all of our constituents, and that includes hosting video and audio updates, sending them out to the media, sharing them with the public at large. And we also have employed, or underemployed, are a couple of statisticians that run our local numbers to give us a better snapshot of exactly what's happening here in the city. As it turns out, in this instance, we are fortunate to be one of the communities in Indiana who still have a health commissioner, and a very fine one at that. Dr. Roland Walker has certainly been at the forefront of this, communicating back and forth with the state. I think he was probably one of the first doctors, or one of the first in terms of community efforts, to actually reach out to the state in terms of trying to secure additional testing. He too has worked through a positive result, or positive test result. He came out of it pretty well, but his parents were also affected by it, both of them. And at this particular point, his mom is still ill, so I ask that all of us around the state keep Dr. Walker and his family in our prayers as well.
I'm so sorry to hear that, Mayor. I've enjoyed working with Dr. Walker immensely, and he has been a great partner for us, and he has not mentioned that to us in all the times he's been on phone calls. So we certainly will add his parents to our prayer list.
Thank you.
Thank you, Mayor Prince, for being with us. And thank you, Mayor Moore. And I hope if you're able to stay with us, folks may have some questions for you both as we get to that Q&A section. Rachel, I'm going to call an audible here and go to Cindy. We had the Indiana Supreme Court ruled fairly swiftly just this week, and we've taken a question about the garnishment of a stimulus check for certain reasons. You want to give an update on the decision that they just brought down yesterday?
Absolutely. Cindy Carrasco, Deputy General Counsel for the Governor. The Indiana Supreme Court issued an order yesterday protecting stimulus checks, in part from being seized by creditors to pay past due bills. Indiana Legal Services and other groups had petitioned the court to protect stimulus checks, and the groups argued that the checks were intended to help households cover basic necessities such as food and rent during the COVID-19 emergency, and as such, that creditors should not be allowed to take the stimulus money from their debtors. In their opinion, the court agreed in part and denied the request in part, specifically finding that state courts may not issue new orders that would take stimulus payments from a debtor. A debtor who has an existing hold on their bank account can request a hearing from a court to prevent a creditor from taking their stimulus check. Now, the protections of the stimulus money would not apply to child support orders.
Thank you, Cindy. That's the Indiana Supreme Court operating at the speed of the need as well. We are certainly appreciative of them. Also wanted to say before we get to the Q&A just how appreciative we are of the Outdoor Advertising Association of Indiana. They've got a campaign like I've never seen before. They're operating in 19 different markets. They got 79 different billboards, all stressing the stay home and stay safe theme. And that's going to, in turn, save lives. It's just a reminder of all the difficult steps that we not should take, but that we must take. So we do flatten the curve. So we do spread or flatten that drawing out this whole process, so we can get back to work in an orderly way. It reminds us of, because of that conduct, because of that, the sacrifices that we're all making, all the success stories that we continue to hear. We had one forwarded to us from Riverview Health in Noblesville, Indiana, where they shared a story of Gerald, who is a 91-year-old veteran, both of Vietnam. You're seeing him now, I guess, at home. Veteran of Vietnam and Korea, and he beat COVID-19, and he was admitted on March 10th, spent a number of days in the ICU, and was then able to actually be with his family on Easter. And what a touching story. That his service and career reminds me, we've now lost more Americans to COVID-19 than we did in Korea, in the Korean conflict, the Korean War. So it all puts it into perspective, and all the docs and nurses that were instrumental in Gerald's recovery also brings to the forefront all the people behind the scenes that you just never, we talk about the grocery store workers, and we talk about everyone that you're kind of right up in their grill with them, hopefully 6 feet apart, so hopefully you're not in their grill. But all the folks that supply behind the scenes, like guns and hoses in this regard. It's a non-profit charity of police and firefighters and first responders, this particular one in Fort Wayne, Indiana, and they're partnered with a corporate entity, Custom Maintenance Solutions, and they're able to say thank you to all those local hospitals when they're cleaning, when they're doing all the work that has to go on that folks don't see, and we just wanted to say thank you. In this case, that partnership up in Fort Wayne, they ended up going out and buying 700 gift cards to local restaurants. So the very restaurants that are in need of business as well, this is a twofer, and it's a win-win, and really a triple win for all of us as we see Hoosiers come together and address those needs in community by community, whether it be in Gary or Jeffersonville or every point in between. And with that, we'll go right to Q&A.
Matt McKinney, WRTV.
Hello, Matt. Thanks for being with us.
Hello, Governor. We've received a couple of questions here from restaurant owners and managers that are concerned about notice whenever we do get to that point of them opening back up. They were concerned about being able to stock their food, get their staff ready, things like that. Do you have any idea of how much notice you're planning on giving restaurants or even other businesses when we get to that point?
Well, tomorrow by the close of business, not that they need to be ready by tomorrow by the close of business, but tomorrow by the close of business, we've asked for various associations, theirs included, for recommendations on how to safely restart business. Obviously, business will look different, but this will be after May 1. We haven't sent a date out to them or to the public yet. We're going to review those plans, and it will be directly dependent on what the numbers are on the ground that allows us to address not when necessarily, but how. We got to get the how down. We can be prepared. We're trying to do all of our work right now so that we can answer that how question, because the when will become apparent to us when the numbers say we need to start to move on this, and in a gradual, incremental way. So folks right now, whether it's restaurants or barbershops, need to be thinking about in the future when we do come online, how will we do business differently? Long list. I've been so encouraged by, as I said yesterday, by the input that we're seeing from around the state of Indiana in all quadrants, and central Indiana as well, about how they want to make sure that their customers and their employees, they themselves, are in a safe environment. And so to answer your question directly, we don't have a date yet, but I'd start, just like a farmer, I'd start tilling the ground right now. I'd start preparing right now so you don't wake up when the time is ready. And by the way, your competitors are open up and you're not. So be prepared, but the numbers will drive that, and you will start to see, you will be informed from these daily updates on when we're getting closer to that day, but it'll be in May, but that time will go like that. Yeah.
Elizabeth, PBS, Michiana.
Hello, Elizabeth. Good afternoon.
Thank you. Good afternoon, Governor, and also thank you for all of the work that you are doing to keep Hoosiers safe. You and your team have really been focused on data and on advice from medical professionals and reminding us of our commitment to protect one another, and our viewers sure do appreciate that. I have a request for clarification from Dr. Box.
Okay.
An April 17th story by the Indianapolis Monthly reported that when Zach Kahn spoke to you by phone on Thursday, April 9th, you accepted his offer to provide 2,000 anterior swabs, but declined his offer to provide as many COVID-19 testing kits as the state needed. Mr. Kahn has said that he could provide up to 50,000 kits per week and would provide them for free if the state could not afford them. Yesterday, you suggested that the idea that you had turned down supplies from Mr. Khan was an internet rumor that was not in fact true. And this seems to have left some viewers wondering whether there was a misunderstanding on the part of Mr. Khan or a reporting error on the part of media outlets covering this story. I wondered if you could clarify.
I wish I could. I don't know how to clarify how a mistake gets started and then gets perpetuated. But I can tell you on that phone call, there was never an offer of 50,000 free kits. In fact, the discussion, as I said, was that we've been doing pretty well with viral transport media because we've got Lilly making that for us, and now a subsidiary of Cook has been doing that. And what we were really having issues with was swabs, and so the conversation took that turn, and that's when he offered us the 2,000 free swabs and delivered them the next day like a great Hoosier partner. So I wish I could tell you how that got started, but I don't have any insight into that.
Could I rewind to the previous question, just because I mentioned that we're receiving a lot of input and recommendations, suggestions about how to do business in the future, and that we've reached out to all the associations. It just occurred to me that not everybody's a member of an association, and so if you've got your own business and you're an entrepreneur and you went out and blazed your own trail, you might be thinking, well, that's great that someone is putting that together, but how will it affect me? And I want to kind of know what the administration, from a both state and a local perspective, what we're thinking. And I'll just give you very quickly a list of examples of what folks are starting to kind of wrap their heads around the new way to do business. They may seem obvious, but this is going to make a big difference to the consumer or to the customer or to the employee and to the employer, how these are actually rolled out. And they will take some work, to the point of the question. And that has to do with cleaning protocols, how often on a regular basis that you're disinfecting, keeping surfaces clean. It has to do with physical distancing, reducing the density which you maybe used to work around, making sure there's 6 feet, making sure you understand the total square footage of a facility, how many people are in, including the staff and including the customers, redesigning the workplace space, the flow of production, installing physical barriers. That's happening right now. We're working with some companies all over the state of Indiana, and physical barriers are being installed, kind of clear plexiglass that prevents that spread. Visitation policies, that's not really has anything to do with restaurants, but in some of the confined areas of living or contained areas of living, it does. Bringing in your own food. A lot of, initially, there are cafeterias in some of our larger businesses where people all come together, and it may be a smart thing for folks to be talking about bringing in your own, brown bag, at least in the initial phase of all of this. Wearing masks, wearing gloves, washing your hands on a regular basis throughout the day, hand sanitizer being provided, limiting the size of gatherings. I mentioned the cafeteria, but it's not just there, break rooms, et cetera, the kind of the old ways that we used to catch up with one another at the workplace. Travel, depending on your type of business, will be changed. I'm not just talking about international travel, but domestic, whether it's car or air. Taking your temperature. If you feel like you have a fever, whether it's the beginning of the day or end of the day, some employers are talking about doing this on a very regular basis when you're starting to maybe show symptoms, or maybe even before that. Testing that will occur down the line as well from an employer's perspective. And then if in fact you are, if you do become positive for COVID-19, what is the protocol that goes into place? And that's what Dr. Box has talked about, self-isolation. And employers will have to have a whole part of the manual just devoted to that, so people don't, when they're self-isolating for 14 plus days, that they don't think, well, I'm going to lose my job, or when I do come back. And so there's all kinds of, Mayor Prince mentioned, and so did Mayor Moore, he alluded to, that communication, that constant communication with the folks that you're coming in contact with.
Lindsay Erdody, the Indianapolis Business Journal.
Thank you, Lindsay, for tolerating that filibuster.
No problem, Governor. I'm curious, this might be kind of related to that. How often is your economic relief and recovery team meeting with you, and what are you hearing from them?
Oh, about every 12 minutes. We meet constantly. Chris, you want to come up and give an update on where we are, or Secretary Schellinger, you might want to add to that. But, you know, Lindsay, so much information is coming in, and thankfully, from our federal partners, we're making some progress, I believe, today. And so there's kind of two sides to this. There's the restart, the reconstruction of businesses that are already here, and then there's also the citizen rebuilding and rebooting their lives as well. You want to give us an update on how often you're not just meeting, which is daily, but what's coming from those meetings?
Absolutely. Chris Johnston from the Office of Management and Budget. We do have daily calls. If we don't meet in person with the folks that do come into the office. The situation is very fluid, and in fact, the federal government just announced an agreement in principle on some additional federal relief packages that will be taken up by the U.S. Senate this afternoon, and then on to the House of Representatives later this week. One of the things that the governor mentioned was the outreach to the industry groups, and really besides the federal relief package administration, what the team is really looking at is the intersection between the guidance from the public health team as far as reopening the economy, of working with the industry groups as their preparedness and what it's going to take to reopen. And so we're going to have a merger of both of those disciplines in order to have a concerted effort with the rollout when the word comes that it's time to do that.
And that package that you just referred to, about $475 billion, I mean, for the country, or
right?
Yeah, that's the agreement that they're in front.
That's right. It's about $400 billion, and it's really a replenishment of the Paycheck Protection Program. But there's also additional assistance for hospitals and some assistance for additional testing. The actual allocations by state is not public yet.
Jeff Smith?
But we're bird dogging it. Yeah, Jeff Smith. Jeff, thanks for being with us again this afternoon.
I appreciate you taking the time. The question is about Cass County. Their caseload has increased about 24% in each of the last 2 days, so Monday and Tuesday. So Dr. Box and or the governor, if you could address the caseload up there in general, and specifically, it looks like as of yesterday, with 86 cases, there were only 109 tests that had been conducted. Today, with 107 cases, there are 124 tests. Is testing a problem in Cass County? And you know, what's the story up there in general?
Those are very good questions. Actually, testing is really, they're doing a great job in Cass County. They have the hospital there and the local health department that are doing drive-through testing, I believe, at their fairgrounds area there. So they have made testing accessible. We have been up there because of some cases in a factory up there, and have been working very closely because, as you know, when we all work closely together, sometimes even stay together during a week's period of time and then go back to our families, that's kind of a congregate living setting also. So that's how we can end up with that many cases. So my state epi team has actually gone in to help Cass County's local health department. They've been doing an incredible job of tracking these cases down, but the numbers have become somewhat overwhelming. And I've been on phone calls, as has my state epidemiologist, not only with this particular factory, but also our plant, but also with the county commissioners, the local health department, and the local hospital there. At this point, the hospital has not had a significant, or as the last time I talked to him, any cases in the hospital, but the potential certainly exists. So we're aware of it and very engaged there.
Yeah, and I would say this is another example. I spoke to of this particular plant, the CEO this morning, and they have made all the necessary changes so that is a safe working environment.
Emma Kate Chalkbeat.
Hello, Emma.
Hi, Governor. In a press conference today, State Superintendent Jennifer McCormick called internet access a statewide issue, not a schools issue, saying that getting families access is just as important as getting I-69 paved. Is there a statewide solution?
Well, we have to do both. And it's definitely a balance. I see Katie Jenner, you might want to, I see you circling. This is a perfect example of this partnership that has to be in place from a local and state, and yes, we've received some federal help toward this front, but we have been way out in front in terms of internet connections. We've devoted, that's the whole reason why we, a year ago, devoted $100 million to building out our internet, bridging that digital divide and building out our internet connections. You might want to talk about from a trustee perspective all the way to what we're doing at the state, because Dr. McCormick points out something that's critically important when we're talking about whether it's the option of remote learning or e-learning, et cetera, what's going to work for an individual community.
Sure. I'm Katie Jenner, Senior Education Advisor for Governor Holcomb. Thank you for the question, Emma Kate. And just to open, I'd like to express significant appreciation for the Indiana Department of Education, the State Board of Education, and the Commission for Higher Education, as they have been pretty incredible partners through this process, very collaborative. We've also had a myriad of educational leaders from the K-12 world on into higher education who have reached out and said to us, we want to be a part of the solution, which I think it expresses the Hoosier way, as the governor frequently talks about. But to your question specifically, that extends with not only connectivity, but also device availability, and also the training of our educators in the K-12 world and in higher ed, our professors. So connectivity will continue to be a priority for our state as we look not only locally to rural school districts, but also as we look at urban school districts. And I'll point out one pretty interesting success story that you're probably aware of is the local partnership in Marion County with philanthropists and school districts and the mayor's office to really focus on how they might work together on some connectivity solutions. And that's one of several examples I could share. But again, a lot of work happening not only at the local but also at the state level around these areas.
Thank you.
Michael WBEZ.
Good afternoon, Michael.
Good afternoon, Governor, and good afternoon, Dr. Fox. I appreciate your daily updates. Governor, I have two questions. One, the mayor of Hammond yesterday mentioned that he's concerned that once Indiana opens and before the state of Illinois, that there could be a floodgate open of people from Chicago coming over the state line to do business. Is there any concerns about that? What can be done? And also, I know in Gary, the Army Corps of Engineers was close to setting up a field hospital. What's the status of that? And because Gary is now seeing about 25 new cases a day.
I will buy the Adjutant General Lyles 30 seconds here and answer your first question first, and he can get to the second question that you just had. Mayor McDermott is right to be concerned. So are we, not just on the Lake County border, but every county that touches another state in Indiana. And that's why we're taking a collaborative approach. That's why I'm working with the governors in our region, and in fact beyond that, but the Great Lakes region, we're all in contact about any moves that we might make. And so while we're not dependent on them, we want to make sure that when we do make a move, that it's the right move in that region. And that's why I often talk about, there is no one size fits all. There is no one region that's exactly like another region, whether you look at, like we did today, Jeffersonville and Gary, Indiana. They're just different, and they have different, Louisville and Chicago metropolitan areas right on the other side of the border. And so he's right to be looking at that, and we'll continue to work with not just the mayor of Hammond or Gary, but that whole region before we make any decisions. And General, you want to talk about the position that we're in right now in the region?
Sure. So yeah, the local surge plan in Gary has been at the forefront of our thoughts because of the potential for movement from Chicago into the Gary area. And so working with the mayor and also working very closely with Dr. Walker, we have done site reconnaissance at the Genesis Center as well as a high school there in Gary. And what our surge plan will be for the Gary area is we will pre-position a surge capability called a medical augmentation package, which consists of 50 beds that we could potentially put at any place in the Gary area. And we'll have that pre-positioned and set up to handle any surge requirements in the Gary area by the end of the week. And so that's what our surge plan is there. We're staying very cognizant of what's going on in Gary, working very closely with the Commissioner of Health to understand what would trigger that. And so the conditions are set to do that. Thank you.
Thank you, General.
Kayla Sullivan, Fox 59.
Good afternoon, Kayla.
Good afternoon, Governor. So Indiana Long-Term Care Facilities Public Advocate Lynn Clow told Fox 59 today that the state could identify specific nursing homes and report their COVID-19 outbreak numbers and deaths without violating HIPAA rules and confidentiality. Dr. Box, do you agree? Please explain.
So I did bring some additional numbers for you today. They are, again, aggregate numbers as we've talked, and I just got off a phone call with AARP discussing the same issue. We do have 199 facilities that have a total of 1,568 cases. Unfortunately, 162 deaths in 74 different facilities. At this point, that is the extent to which we want to report data.
Jacqueline Ryan, Stark County Leader.
Good afternoon. Thanks for being with us.
Thanks for taking my question.
Sure.
So this has to do with the eventual reopening of businesses and the implementation of specific sanitation standards. I understand there's a lot of factors to consider with that, but is there any kind of internal coordination or organization happening at the state level to ensure that supplies and PPE will be available for business owners in all 92 counties, especially since right now people are already having some difficulties finding those items just for their own homes?
Yeah, there will, when the plan is actually presented, and we'll be, we're in receipt right now and will continue to be through the close of business, and I suspect there'll be some tardy submissions too that come in after the 22nd to close of business. But we'll compile all that, and then we'll present that in a following executive order so folks know not just what that standard is, but also I envision included in that, because I've been talking to different sectors and different industries where they're going to, if it's a mask order or a glove order or a gown order, et cetera, they'll also include, and we will as well, where folks can purchase them. Now that's happening right now in companies all over the state of Indiana for our essential companies. They have already started to turn and burn and reacclimate and reorient the way they do business. And so we'll absolutely be able to point out places, repositories where you can order as well to make sure that your employees are safe doing business at your establishment.
Tom Davies, The Associated Press.
Hello, Tom. Good afternoon.
Hello, Governor. Thank you for the update, Dr. Box, on the number of nursing home cases. But can you also update where you stand with the state prisons? And also, are there any additional deaths at the Bethany Point and large outbreaks of that with the nursing homes? And why not? You didn't address the question of why not providing the families and the public with information about particular nursing homes.
So again, I will say that the families of these individuals that live in or reside in these residential facilities or these nursing homes are to be notified by the nursing home, and the recent CMS regulations, so Medicare and Medicaid regulations, are requiring them to notify families of any positive cases and update them on additional positive cases and to update them on any deaths that occur in those facilities. So that's where we're going to leave that at this point.
Bethany Point, any change?
I'm sorry, I don't know of any additional deaths there.
Rob.
Hi, Rob Carter, Department of Correction. We currently have 233 offenders that have tested positive, and we're up to 10 facilities.
Mary Ann Ahern, NBC Chicago.
Sure. Hello, Mary Ann. Good afternoon.
Hi, thank you so much. Following up on Michael from WBEZ, could you just be a little more specific? When you make the changes to your stay-at-home order, will they be done regionally or will they be done statewide?
Depends on the change. Could be both. It depends on the change that's made, and the numbers will reflect that. In different, and I've always called them health districts, the 10 different health districts, but it could be, depending on the change, Mary Ann, it could be a whole statewide change all at once, or depending on the change, it could be more regionally focused.
Cassie Garrett, Whitewater Publications.
Good afternoon, Cassie.
Hi, how are you?
I'm doing good. How are you doing?
I'm good, thank you. I have two questions as well. The first one, Governor, is for you.
Okay.
As you talked through the progress being made by businesses across the state, as Hoosiers are kind of gearing up to reopen when the time comes, and they're sending different systems that they're creating and putting in place, such as shields and other innovative ideas, do you believe that there will be official regulations eventually that will come out for businesses so that local health departments can follow up and do inspections to make sure that businesses are taking the proper initiatives outlined by the governor or the health department to make sure that they're stopping the spread of COVID-19? And Dr. Box, the question for you is regarding retesting. Locally in the community, we've heard of several different community members that have been retested during their hospital stay. And we've seen results come back where some are shedding the virus very quickly in 2 to 3 weeks, and others are not shedding the virus, they're holding it much longer. Is there any data or analysis being done on that yet and helping guide us on what is causing some people to shed that virus more quickly than others?
That's a really good question. The CDC's original and now most recent recommendations were that you could, in order to kind of deem a person free of the virus, actually do testing one day and then repeat that testing the next day. That is pretty cumbersome and uses up a lot of testing. The other options are for that individual to have been a minimum of 7 days from their first symptoms, and then an additional 72 hours beyond any type of symptoms. So a cough, a fever, you can't be using Tylenol to bring your fever down. So that's what most of us have been using. Realistically, most people that we've talked to take quite a bit longer than that to feel better and for their symptoms to resolve and to get better. Some of the original studies, and those are not Indiana studies, but have shown that individuals will shed this virus for anywhere from 21 to 24 days, and the longest that I've heard so far in a report was 30 days. But whether they're infective at that point is difficult to know.
And if the viewers remember the first question, I can get right to the point. The answer is we'll continue to investigate any formal complaint that comes into our office, just as we always have. We'll follow up on that. I understand folks are antsy to get back to work. Folks are antsy to get up and going, myself included. We clarified pet groomers yesterday, and I've contemplated going to a pet groomer to get my hair cut. I've been cutting my own hair, like I suspect a lot of other folks have as well. My wife told me to not go there, that there are some roots showing around the state of Indiana too. And so she would gladly cut my hair for me if that would settle me down. But having said that, anyone that's, experiencing that antsiness or that impatience to get back at work, I'm just telling you, use this time to prepare for when that day gets here, depending on your industry, your sector. Let's not squander this opportunity to make those changes right now, proactively. So when that day does come, we're not focused on following up and investigating on a complaint by good, honest Hoosiers that want to make sure that they're doing business in a place that's safe.
Eric Furman, WIBC.
Good afternoon, Eric.
Afternoon, Governor. I wanted to go back to the question about cases in the Department of Correction. Ohio has done mass testing across the prison system and had large numbers of positive cases coming back. Are we contemplating that kind of testing every inmate? If yes, when would that happen? If not, why is that not on the radar?
Yep. Dr. Doss is prepared to answer that directly.
This is Dr. Kristen Doss, Chief Medical Officer for Indiana Department of Correction. We actually were in touch with Ohio Department of Correction overnight and again this morning just to kind of figure out the logistics of how they made that happen. We're looking at what they are doing and we're seeing how we can replicate a similar model here in Indiana. I don't have anything firmed up that I could share at this time though.
Thank you.
Jody Kaufman, WRBI.
Sure. Good afternoon, Jody.
Good afternoon, Governor. Thank you for bringing the drive-through testing to our region. My question is kind of in regards to your announcement yesterday on allowing the possibility of elective surgeries in the next 7 days. Will there be testing of our healthcare workers, our first responders that are asymptomatic before we allow the public to be around those people and possibly infect people that aren't sick yet?
So the ability to test every single healthcare worker really doesn't exist at this time. And unfortunately, if they were negative today, I wouldn't be comfortable that they came back the next day and were taking care of your grandma or your mom or someone else and could not be positive the next day. So that doesn't give us a lot of information. What really helps is the hand washing, the hygiene, the changing of the scrubs, and making sure that you're wearing a mask at all times when you're caring for people. I've actually heard the other question of testing individuals before they come in to have surgery as to whether they could be COVID-19 positive, not necessarily worrying that they're going to infect other people, but they could. But how will they do in their recovery time after whatever surgery they're having, and could that contribute to a poor recovery?
Bob Siegel, WTHR.
Good afternoon, Bob.
Hello, Governor. Hello, Dr. Box. Thank you so much for these daily briefings and for taking our questions. I do have two questions. My first is for the governor. Some governors are looking at reopening their states in the next 7 days, a very aggressive time frame. Wondering if you feel that is overly aggressive, and what is your latest time frame, if you can discuss again, for reopening Indiana and the criteria and the people you'll be listening to when you do that.
Well, Bob, it's a very layered question. Depends on the state, depends on their numbers, depends on, so I'm not second guessing folks who are in Texas or Georgia, some of them that I've been reading recently. I'm assuming they're looking at the same numbers that I'm looking at in my state, in their state. And I can't tell you if they're going to approach this regionally or not. Some of the areas that you might be referencing has to do with things that we've been doing. Some are opening up retail business as an example, but they're opening up curbside. We've been doing that. And so it's kind of a hodgepodge effort across the country, because it has to be, because there are different numbers in different states. And so, I'll just share with you that we're going to be informed by the numbers as they are before us, day in and day out. And we're not going to try to get around the numbers. We're not going to make any decisions prematurely. This is going to be a safety first approach. And we'll keep that posture throughout the duration of this. And the day that we get to a vaccine, which is 12 or 14 or 18 months, I don't have the crystal ball here. I'm going to go buy one. I'm going to get a crystal ball. But the day that we get that, we'll be able to make a lot of other decisions as well.
Good idea.
Whitney Downard, CNHI.
Did Bob have, we can go back to Bob. I think Bob said he had multiple questions, but we'll go with Whitney, you're on, and then we'll go back to Bob. I think he said he had 2.
Hi, my question is more for Dr. Bach.
Okay.
I was wondering if we had more information about how this virus, or where this virus is spreading specifically. We have some CDC studies of specific instances of family birthday party, for example. But are we seeing this spread at the grocery stores that are remaining open? You know, what specific locations are we seeing this virus spread?
It's a really good question. When we originally started tracing this, it was very clear that it was large gatherings like weddings and funerals and big international conferences or conventions that came. Now that situation appears to be more oftentimes in a healthcare setting. It may be someone that has, as you know, works outside or goes outside and then comes back and works in a long-term care facility, works in a prison, works in a jail. Certainly individuals that are getting on and off public transportation can infect other people that are close to them, or the individuals that are, for instance, the bus drivers. I'm sure that there can be spread in different grocery stores around the state. I have seen many things that they've done to try to prevent that, but I definitely have seen cases where individuals that work in grocery stores have become infected.
And that's where the tracing becomes down the road even
Absolutely.
more and more important. Yes.
Back to Bob Siegel. Bob, if you're still with us.
Back to Bob.
I'm still here. Thanks, Governor, for letting me ask a second question today. This one's for Dr. Box, and it's another question about releasing more detailed information about COVID-19 in nursing homes. You've been releasing the aggregate numbers, and we very much appreciate that. Yesterday, you said you might consider releasing information in specific nursing homes, but you've been trying to avoid that because you think it's a personal thing between the facility and the families. Today, you mentioned that aggregate information is the extent you want to report on data, but we continue to hear daily. It's the most common question that I get from our viewers, from families desperately trying to find out information about what's happening in nursing homes. In some cases, they can't even get a nursing home to answer the phone to update them on their loved one's condition, let alone what steps they're taking about COVID-19 and how much, if any, is infecting the facility. So Indiana is now collecting detailed information from nursing homes. This isn't a federal issue, it's a state transparency issue. My question to you is, why won't you commit to doing what some other states are now doing by releasing detailed nursing home information related to COVID? And if you won't do that, is there a legal reason Indiana is citing for not releasing that information?
So we do collect detailed information, and all of those cases in long-term care facilities are reportable to us, as are any deaths, and we are engaged with absolutely everyone who reports an individual who is ill or sick in their long-term care facility. My Department of Regulatory Division actually oversees long-term care facilities and residential facilities, and especially with the new CMS regulations in place, if that is not happening and families are not being notified and they're not being updated and they don't answer the phone and they don't give you feedback, then that is something that can be reported to us, and we can look into that and definitely will look into that.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern.